What might you as patients want to know is the hot news from ASH 2015. So the hot news, I think, is that the MPN field continues to be extremely active in terms of both drug-related research and basic science research. There's been a huge amount of interest and many steps forward in terms of understanding mutations and their impact upon disease, how many patients might be affected by mutations, but we have a little bit of a way to go in terms of understanding how this might impact your disease, particularly if you're a patient with polycythemia vera or essential thrombocythemia. If you're a patient with myelofibrosis, I might say that we're a few steps ahead in understanding that some mutations may well make us wish to monitor you more closely, for example, or consider a specific therapy, although we're not quite there yet. We may well be interested in offering you a clinical trial, looking, for example, at how ruxolitinib might impact patients with specific mutations, and this will certainly be opening early in 2016. Concerning other data from ASH, we've heard both new data with regard to drugs such as imetelstat, learning more about how patients respond with different diseases to this drug, and hearing about a big study that's opening in 2016 and is open already in some centres. We also heard more about the pentraxin analogue, PRM151, more detail about responses, and again that there's going to be a big study with that drug. But concerning the JAK inhibitors, we saw more details with regard to pacritinib from the PERSIST-1 study. We know that many subgroups of patients will respond well to this drug, but particularly that this drug offers a useful therapy for patients who have very low blood counts, specifically low platelet counts, less than 50, and also may allow patients to become independent of red blood cell transfusions. Concerning ruxolitinib, we have delivered the final results of the COMFORT-2 study, looking at almost 500 years of patients treated with this drug, showing important data. The drug continues to be safe, the drug continues to control spleen size for patients, and patients treated with this drug continue to live longer than they would have done otherwise. Interestingly, in this study we also showed that some patients do achieve important improvements in their bone marrow with ruxolitinib. Does that mean that we as doctors will be doing more bone marrows on you? Well, I think you'll be pleased to hear that's not the case. But it tells us more about how these drugs might be working to control your disease. So I think this ASH was very reassuring, very exciting, as well as really exhausting for many of us that were taking part in the Congress.